Hi everyone, I'm Stefan from the Southampton University Hospital Trust. Welcome to today's Ask About Asthma video. So I've been asked to talk to you about salbutamol weaning today and how we've implemented this in our trust locally and Wessex-wide. So we are aware that salbutamol overuse is very common and a big thing that the NHS is trying to reduce. And we wanted to look at how we could reduce that in our emergency departments and move away from high fixed dose weaning plans. So what do? We put together a group of professionals and used parent forums to work out a way that we could do this in a way that would work safely with everybody. We held parent forums to look at the format that we would have this document in and eventually created a draft document. This draft document used things like colour coding, so sticking with the red, amber, green rating on our flowchart so that parents that are familiar to our Wessex Healthier Together guidance could follow that. We also included information about what Wheeze was and provided safety netting advice. We wanted to make sure this was really clear for everyone that was going to be using it. So we included lots of pictures as well as written instruction and QR codes for people to watch videos. To implement this, we needed the support of all of our team locally. So we provided education to people that would be using this in practice. So we spent some time in the emergency department and with our secondary care professionals working on the wards to allow this to work in practice. We trialled it initially on 16 patients before rolling it out and then collecting data on 103 patients. There was a 2/3 reduction in the amount of salbutamol usage compared to when we were using high fixed dose weaning plans. Using this and to know it worked, we looked at our reattendance rates for this to make sure that we were being safe in what we were doing with changing practice. And we saw that there was no increase in reattendance rates during the period since we last implemented this. So we then looked at spreading it out to the wider community, to the rest of our Wessex region, and had good reception from our colleagues around the rest of the region. It's taken a little while to fully implement this plan because it is a big change, and helping people to understand why this change is needed has been really important. So my 3 top tips for reducing salbutamol usage would be to ensure that education is given to all people who are going to be seeing these patients with episodes of wheeze. It's really important that they understand why giving high doses of salbutamol isn't right and shouldn't be used, and educating those professionals is really important. The other thing would be to make sure that people are giving consistent advice. So we have in the emergency department, especially, people will give their own version of weaning plans, and to make sure people are giving consistent advice is really important, which is why we have implemented a one-sheet plan for anyone with a diagnosis of wheeze, whether that is asthma or viral-induced wheeze, so that there is no misdiagnosis. I think the third thing that's important for implementing this is to have the support of parents and to make sure that they are able to use the plan effectively. So making adaptations where possible is really important as well. That brings today's episode to a close. Thank you for listening, and please do visit Ask About Asthma webpages for more videos, podcasts, and to view the full schedule for the week. Thanks and goodbye.